As countries around the world try to deal with increasing cases of coronavirus, the Australian government is being advised to introduce a time-limited Medicare rebate for telehealth consultations to support GPs dealing with cases. The Royal Australian College of General Practitioners President, Dr Harry Nespolon, joins me now live to discuss. Doctor, good afternoon. Thank you so much for joining me.
Hello.
Firstly, why should telehealth be prioritised in this crisis?
Well, what we're having problems with is, people's diagnoses aren't clear, and so one of the ways to deal with this in a very safe way, in other ways that protects the doctors, that protects our staff, our reception staff, and even protects the people in the waiting room, is by being able to triage people over the phone. The government did suggest that they were going to release the details of a telephone Medicare item number on Friday, which didn't happen. And that's been incredibly disappointing for GPs around the country. It's the obvious thing that needs to be done, and it needs to be done now.
Can you take us through just how swamped GPs are at the moment?
Well, it takes quite a lot of resources to have someone come in, first of all, hopefully identify themselves, get them with a mask, put them in a separate room, and then come and deal with them. If they do potentially have coronavirus, that room's out of action for at least half an hour. And most practices are busy, and they don't all have this sort of spare capacity. General practitioners as a group are, again, busy, and so having to try and make time to fit people that are just arriving or coming in with potentially an infectious disease really does cause problems. We certainly do deal with it. But, in my practice, we're getting at least 6 people a day on average coming in with potentially coronavirus. And that virtually takes out a room for the day. It would be much better, much more efficient if we could deal with these over the phone.
What more can the federal government do right now to aid GPs in this time?
Well, as I say, this is really simple in my mind. I don't know what the difficulty is in trying to introduce such an item number. It's very simple. They just need to remove the requirement for the patient to be seen to generate the item number. Having said that, it's not going to cost the Commonwealth an enormous amount of money because these patients are already being seen in the rooms a lot of the time. So we're not talking about an enormous marginal cost. The other thing that the government does need to do is, the other thing that didn't happen on Friday was the beginning of an operational plan for general practice. At the moment, we're not in that pandemic phase where there's lots and lots of people with the infection, and hopefully we don't get to that point. But if we do, the hospitals won't be able to deal with the number of inquiries. They might be able to start the fever clinics, but at the end of the day, most people are going to want to get their advice from their trusted GPs.
Doctor, 6 new coronavirus cases have been identified in New South Wales, 5 of which are local transmissions. There's also a case of a doctor in Melbourne today. Are we in a situation now where this virus just simply cannot be contained?
Well, I think that's what the experts are telling us. They're saying that it can't be contained, especially once you get human-to-human transmission. And the doctor in Melbourne is a perfect example where telephone consultation means that if that doctor was infectious and was seeing patients, that they wouldn't be passing their infection on to their patients. Doctors might see anywhere between 20 to 40 patients in a day, and it might take 2 or 3 days to work out whether or not they're infected. That's a lot of people that potentially will become infected. So it's really time that the government does try and help us minimise the spread of the virus.
From a medical perspective, is it a safe time to travel?
That's a difficult question because, if you were travelling to Italy a week ago or 10 days ago, you would have thought it was reasonably safe. Clearly not very safe to be travelling to northern Italy at the moment. Look, it's a difficult, people are asking questions such as, if I fly out and I go to a country, will I be able to get back in? What are my chances of getting an infection? So at the moment, people are really concerned about both leaving the country while they're on the plane and also getting back home again.
You did mention a potential pandemic, and obviously we hope we don't get to that stage, but at what point could the World Health Organization call this a pandemic, and what would that mean?
Look, calling it a pandemic means that there's often a lot of legal things that flow from it in terms of things like even insurance, I would guess. But I think people are already preparing for that pandemic phase as we speak. I think it's more a sort of a bureaucratic thing at the moment. But, once the declaration's made, we're here in Australia, we're working as if there is a pandemic coming and we should be planning for it.
We've seen a number of cases of medical stockpiling, and there's a number of shortages, of course, of essentials like toilet paper and rice. Is that extreme?
Look, at the moment, let's try and keep it in a little bit of perspective. It is. I mean, we've got less than 70 cases here in Australia, and the chances of you catching it from someone else has increased, but it's still quite small. As I can say, all we can do is hope that people have bought their year's supply of toilet paper and they'll be fine.
And just finally, Doctor, for viewers watching at home, concerned or worried, I mean, what can they do right now? Is there anything they can do right now to try and protect themselves if they're concerned?
Well, the most important part of protecting themselves at the moment are the hygiene issues. So make sure that you are washing your hands. If you are touching surfaces, try and avoid touching your face. Cough into your elbow. If you are around someone who is coughing, probably try and avoid being within 2 metres of them. They're the sorts of things that you need to try to do to avoid the potential risk of acquiring coronavirus if there is someone walking around with it. But at the moment, people should be still going about their daily lives the way that they would normally do it, just being a bit careful and making sure that they're not exposing themselves to unnecessary risks.
Some great advice there, Dr. Harry Nespolon. Thank you so much for your time this afternoon.